we're getting into anxiety disorders. The anxiety is functioning in a way that it's not how it's intended to, it's malfunctioning. Anxiety disorders is really a category in the DSM. There's a whole bunch of types of anxiety disorders. I think an important one to talk more specifically is generalized anxiety disorder. Whenever we're doing a DSM diagnosis, time is very important, how long this has been present in your life. For this one, at least 6 months. Not just 6 months, you feel anxious a day here, a week here. It's most of those 6 months you're feeling this way. The other important distinction is clinically relevant. We always want to be putting what you're talking about in a broader spectrum and look at how it's clinically significant. There are 6 symptoms that we're looking for within generalized anxiety disorder. You have to have at least 3 of them for those 6 months. There's restlessness or feeling keyed up or on edge, being easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, or sleep disturbance. This can be difficulty falling or staying asleep, as well as restless, unsatisfying sleep. A lot of people, when they talk about anxiety, they're actually talking about what they're worried about, what's going on in their life, what kind of stressors are going on. We're looking for how that anxiety, that worry is actually manifesting in them physically and for a prolonged period of time. In a normal state, someone may be worried about, I'm now losing my job. I need to figure this out. I don't know what will happen, and so I'm worried. That is different than, say, instead of being able to apply to a bunch of jobs, solve the problem because I'm worried, I'm now not sleeping. I'm now restless and I can't sit down. I can't concentrate. I can't sleep. How am I then going to actually put some energy and effort into solving this problem? It's starting to become pathologic. This anxiety, it's starting to get in the way of me solving the problem that it initially was there for. In addition to generalized anxiety disorder, there's a bunch more. Separation anxiety disorder, something we'll usually see more in kids, especially as they're going to school, especially as they're leaving their family. We have selective mutism, again, more commonly in younger kids, where they're not speaking, but specifically in certain situations. This is typically where the kid maybe at home speaks, but then doesn't speak at school. A specific phobia, this is where we'll see things like fear of spiders, fear of snakes, fear of heights. I'd say fear on flying in planes is probably the most common one I personally see. Social anxiety disorder, very common. This is past where someone is shy. The degree of anxiety in their social encounters is very severe. There's a lot of debilitation that comes with social anxiety. Panic disorder, it's kind of like they don't have anxiety, and then one day it'll surge. It'll be short-lived, but then the rest of the anxiety is fear of having those panic attacks. Agoraphobia, where people are afraid of public spaces, a fear of being around a lot of people. Substance or medication-induced anxiety, especially steroids, can really exacerbate or cause anxiety. Medical problems, they could have a lot of anxiety because of a medical issue. And the last 2, other specified or unspecified. This is where we're clinically evaluating it. There may be a person here who has this very significant anxiety, but it doesn't fit so perfectly into our other category.